welcome to Research Series FEB UGM. I'm Novat Pugo Sambodo, and I'm delighted to have you with us for this episode. Today, I'm especially honored to be joined by our distinguished guest, Dr. Sabina Albrecht. She is an economist with a background in behavioral economics and applied microeconomics. Currently, Dr. Sabina works as senior data analyst in the impact and evaluation team at Headspace, the National Youth Mental Health Foundation in Australia, bringing her research experience into practical impact. And today we will be discussing very important topic, adolescents' mental health. More specifically, we will explore the Headspace model, a unique approach to design to support the mental well-being of young people. Before we dive into the main discussion, perhaps Dr. Sabina could start by sharing a bit about the urgency of addressing mental health among young people. So, why is adolescence and early adulthood mental health considered such an important topic today, Dr. Sabina?
Thank you, Dr. Pugo. Also, first of all, thank you so much for having me here. It's a pleasure to be here and to talk about this really important topic. So, I guess, youth mental health in the last couple of years, especially since the pandemic, has been discussed quite a lot, that it's getting worse and worse. Young people are struggling with their mental health. And it's actually said to be in crisis a bit. So we see higher rates of depression and anxiety. And this is really impacting on the lives of young people in terms of their education and their employment and how their mental well-being. And I think these sort of, the pandemic is one of the reasons that's often cited as something that has really exacerbated the mental health issue, both in the broader population, but specifically for young people, because they seem to suffer a lot more from the measures that were taken to deal with the pandemic, experience loneliness, and had a larger impact on young people. But in actual fact, there's a lot of research that says that this trend of declining youth mental health has been going on for much longer, and the pandemic has only exacerbated the issue, brought it to the forefront. But it started much earlier, some research says that it sort of coincides with some of these global mega trends that we see, the rise of smartphones and social media. Technological changes in that way, but also environmental changes like climate change, which is something that will be affecting young people as they go through their lives. They will bear the brunt of that. But also a greater economic insecurity, inequality, and all these kinds of trends.
Okay, could you explain how the adolescent mental health challenges are currently perceived by global community publics in a global scale, and also are there a difference between response between developed and developing countries?
Yeah, that's a good question. I think that there are definitely differences across countries, but there's a unifying theme that it seems like youth mental health, we have to do something about it, especially in Western countries. It's perceived as a crisis. Mind you, when you ask young people, they don't like this framing, this narrative, because for them it's a shared experience of struggling, but it's not a crisis. A crisis is a very negative framing of this, but it's sort of shifting the narrative to be more about a shared experience, and how to get out of that could be much more empowering to them. But sort of that's kind of a side note, but the general perception is that it's a crisis. And in Australia especially at the moment, the focus is very much on social media. So we currently have a government that just is about to implement a social media ban for anyone under the age of 16, hoping that this will help some of the mental health issues. But also that is kind of a very blunt instrument, because it's a blanket ban on everyone. Young people are felt a bit left out from this discussion. and have perhaps a more nuanced view about this. Whether a ban is the right answer or not is a bit unclear to them, because social media is also a lifeline to many of the marginalized communities, the ones that have larger struggles with mental health, thinking about LGBT young people or other from very rural communities, for instance. Social media can be a lifeline. So the perception in Australia is that it's a crisis. Social media is the current focus. In the US, it's a bit similar, I think. There, they also have the addition of a drug crisis. I think in many Western countries, there's a lot of discussion about this. I think in developing countries, perhaps, many of these global issues affect them in the same way. But perhaps the discussion is starting from a different starting point. That's at least my impression, but there's definitely a lot of interest. So I went to a couple of big conferences this year, one in Canada, in Vancouver, the International Association of Youth Mental Health had their biannual congress there, and there were a lot of sessions focused on developing countries and youth mental health. And also in the recent Health Economics Association Congress in Bali, I was very pleased to see full sessions dedicated to mental health in Indonesia.
Okay, now we move on to the Headspace, the institution that you work now. So Headspace, based on the references we have, is known as an NGO from Australia and focus on adolescents' mental health. Dr. Sabina, from your perspective in the impact of evaluation teams, could you explain what the Headspace model and how it operates in the daily lives of young people?
So Headspace in Australia is, as you said, an NGO. It's a not-for-profit organization. It's the largest provider of youth mental health services in Australia. And it has grown since 2016 into a national network that provides services across all parts of Australia. It's a primary care service provider for early intervention youth mental health care. And that means that includes anyone in the age range 12 to 25. And that was it came about because back in 2006, there was just not enough mental health services available for young people with relatively mild to moderate mental health needs. So not the very severe hospital level services, but depression, anxiety, mental health issues before they hit the threshold of being an actual disorder already deserve some treatment. And with early intervention, you can actually prevent a disorder from actually happening. So the Headspace was established, and the age range is like that because it kind of bridges the gap between child psychiatry services and adult psychiatry services. Because often, at the age of 18, you're kicked out of one system, you have to find a new service provider, and suddenly there's a huge wait time. But you need that continuity of care at this age, especially because the human brain is still developing up until 25, age 25. So that was decided that for this reason, it makes sense to have a youth service that's specialized for young people from 12 to 25. And the idea is also that it's a low access barrier to our service. So you don't need a referral from a GP. You can have one. Many GPs refer young people to Headspace, but you can actually just walk into the door and say, I want to talk to someone. And then it's an integrated service where a multidisciplinary team of people can provide support. So we have therapists, occupational therapists, psychologists, psychiatrists, GPs, or just mental health nurses different professions working together in one space. And sort of each space is called a Headspace Center. And we have about 170 across the country.
170. Okay.
Not every center looks the same. Not everywhere there's a psychiatrist within the center. Sometimes the centers partner with external service providers.
Okay.
Or not every center has a GP. But in general, the idea is that Headspace can integrate services and provide you with links to other services if they can't provide them themselves. And it's kind of got 4 core streams. So mental health and well-being is the biggest core stream, but we also provide physical and sexual health services, alcohol and drug support services, and vocational support, education and vocational support, because that's quite often interlinked with mental health.
That's quite complete.
It's very comprehensive.
Comprehensive, yes. And based your experience analyzing data at the Headspace, what make this model, the Headspace model, different with the traditional mental health service approach?
I think it's really the integrated nature of it, and also that it's sort of youth-led, I guess. We have a lot of we as the organization, we center the voice of young people and their families at everything that we do. So that we have board members, we have advisory groups from that are young people, all with lived experience of mental health. So they provide their perspective and on what helps them. We also integrate peer workers in the services. I've just recently seen some data that I analyzed some data that showed that actually when somebody receives a service from a peer worker, which is someone who also experienced youth mental health issues but has sort of grown out of that, not grown out of that, but sorry. Lacking the word, has sort of overcome these issues and is now working as a peer worker. The young person reports a better experience. So it helps them in achieving their own mental health outcomes because they can see that there's a.
So the treatment will be more relevant because
I
they
think
are.
so. Yeah, that's right.
Yeah. Could you share any interesting experience on a story where the data that you evaluate maybe have shown your sexually supported young people?
Yeah, we have a lot of qualitative data on that as well, which we publish as evaluation reports. But one quantitative study that I led last year was an evaluation of what's called the IPS program. It's called Individual Placement Support Program, which basically integrates individualized vocational and educational support within the mental health care services. So when a young person comes and struggles with finding a job and because of that experiences anxiety and depression, it's kind of a self-reinforcing cycle. It's a bit unclear what's at the start and what's coming afterwards, but they can access this IPS program, which means that they have a dedicated worker who works with them on a plan for what they want to achieve in their studies or for work, and really supports them to find something quickly. And at the same time, they also receive like a standard mental health service. And the analysis, it was a matched cohort study, showed that actually young people who go through this program receive not only positive vocational outcomes, but they also have stronger mental health outcomes compared to someone who just goes to normal mental health services.
Wow. With the additional questions with this very advanced and integrated and then also complete mental health service, who actually funded this program?
It's funded by the Australian government.
Okay.
So it's
So taxpayers.
Yes, and it's got bipartisan support. So in Australia, mostly two major parties. So every election cycle, it's sort of a question which of the major parties will be in power. But Headspace is very fortunate to have the support from both parties.
Okay.
The funding model is quite complicated because they're states that fund some services, and then the federal government funds other services, and some programs, because I've only told you the core program. We still have more additional programs. Some of them are funded through, grants that are limited in time. So the funding model is quite complex and is a constant issue. But we're very fortunate that Headspace has demonstrated its worth and has grown.
So it's a combination between the federal and the states, and also some of the maybe other
grants.
Grants.
Yeah, that's right. Yeah.
Wow, cool. And because we see this type of these models, is we want to know the relevance for low and middle income countries, such as Indonesia. So, what do you think about the requirement or Headspace model may be adapted in Indonesia, and what challenges and opportunities that might arise?
Yeah, that's a big question. I think the key is to think back to the start. We didn't start out this big with this many programs. It actually has grown quite organically over time. And sometimes within, I work for the kind of the backbone organization, the Headspace National, and all the little centers have their own lead agency. So we're kind of we're providing the backbone support. We sometimes joke that, everything is a little bit different because we've grown so organically.
Okay.
So starting small, I think, is the key, and think about what's feasible. I know that sort of different countries have adapted the model and used it in different ways. For instance, the Headspace Denmark model is a volunteer-based service. So they do have a backbone organization, but that's relatively small, and then the services are provided by volunteers. So it's a very different, the end product looks quite different, but the idea is the same. We're wanting to support young people to be mentally healthy. And something that could perhaps be I guess, adapted more easily is like an online service.
I see.
We have an online service which is called eHeadspace.
eHeadspace, yeah.
That provides web chat, counseling, and other digital services as well. Like there's a kind of like a stepped care approach. You can just access the website and just read the resources. That's kind of the lowest level, but you can also enter a moderated chat online with experts that already gives you a little bit more depth, I guess, and different access. Or you can access an individual chat with a clinician online. But this is perhaps a bit more scalable and easier to implement at the start. And it's also something that we find young people, sort of take to online services as well.
Okay, so I would like to ask what roles, for example, for the university, like we have a faculty of economics and business, and play in supporting the implementation of the mental health service like this. What do you
I think it's important that universities are aware of the mental health issues that can arise for young people when they're studying, and it's great if they can provide some counseling or support that's available. I think the awareness raising is probably the biggest thing, and to know to know what resources are available and where you can direct students too that are struggling. We have one of the Headspace programs also goes to universities to support them in building up the mental health literacy and the capacity of university staff. So teaching them what's important for mental health and how can you help a student when they come to you. How can you start to help them in their journey, and the same support program also comes to universities after a suicide case, for instance, which we call suicide postvention, in which case the whole community needs the support. But that's one of the things that universities can sort of proactively prepare a bit, make sure they have something in place where they know how they can support their students. And awareness raising, I think, is the biggest thing.
Yeah, Dr. Sabina, a little bit related to the economics as a science and framework. Is it help you doing your works, doing in the Headspace? We need like a economics framework on the mental health.
Yeah.
Do you have any?
Yeah, it definitely helps to have the economic analytical mindset and have that framework present. For me in my work, the way I use it is I use it in terms of analysis. I haven't been at Headspace that long yet, but we are planning to do a long-term evaluation of the outcomes of Headspace using econometric methods.
Yes.
So we want to link our Headspace data to administrative data from Australia, and then see how Headspace service users end up in several years in their financial situation, education, health service use based on admin data, and compare that in sort of quasi experimental methods to a different cohort. So for me, this is the economic rigor in evaluating outcomes and programs. I think that's really where my background comes into play.
For
sure.
the evaluation team, right?
I'm very passionate about causal estimation. I can't always do it with the data I have, but I'm very passionate about it.
Okay. Thank you so much, Dr. Sabina, for sharing such a valuable insight on adolescent mental health and the Headspace model. Before we wrap up, perhaps you have one final message to share for young people, for parents, educators who care about mental health.
Yeah, I think my final message would be for young people and their families, just to become aware of mental health and what it means, and how you can support your own mental health. They're very simple strategies that you can do every day, like connecting with other people, or going out into nature or something like that. Many little things can already make a big impact on your mental health, and if you start to learn about mental health, it'll help you, get through any struggles more easily that might arise. And also look out for your friends. Ask them if they're okay. Don't shy away from a difficult conversation about someone's mental health. Can help them.
Okay. Once again, thank you very much, Dr. Sabina, and thank you to all our listeners for joining this episode. Don't forget to share it and stay tuned for more exciting topics on Research Series FEB UGM. See you next time.